Okay, so hi everyone, I'm Latoya. I'm the nurse practitioner today, and with me I have Mr. Ian. And his purpose here today is for me to conduct a head to toe physical assessment on him. Right, Ian?
Yes, ma'am.
Okay, so I already had his verbal and written consent prior to this presentation. Also, I have his vital signs. His temp was 97.9, heart rate 88, his blood pressure was 109/70, and respiration 18. Height, how tall are you, Mr. Ian?
5'9".
Okay. He weighs 200 pounds, and his BMI is close to 30, 29.5. So we'll address that in our assessment also. So, Mr. Ian, are you ready for your assessment, sir?
Yes,
How are
ma'am.
you feeling?
I'm feeling good.
Okay, great. I'm just gonna ask you a couple of the maybe silly questions. You okay with that?
Okay.
Okay. So, you know the date and time?
The date today, roughly, I think today is Monday,
Mm-hmm.
and it's what, the 5th of the 3rd, 2021.
Good. And who's your prime minister of the United States?
Well, the President of the United States is supposed to be Joe Biden.
Okay. In order to conduct this assessment, you know, I already got your consent to touch. You want some hand sanitizer as well?
Yes, ma'am.
Okay, great. So we'll get yourself all clean and sanitized, and we'll get this ball rolling, okay?
Thank you.
All right. Generally speaking, Ian appears to be mid-30s, African American, healthy-looking male. He looks he has a muscular build, skin tone dark, no lesions on his skin. He has a very good posture. He's erect, no signs of spina bifida, and overall looks very healthy. Do I have your permission to touch Mr. Ian?
Okay, ma'am.
Okay. Checking your head, near your face for symmetry. Symmetry looks normal, no abnormalities noted. I'm gonna palpate your temporal pulse. Pulse is about a 2+, not too weak, not too strong, which is good. Any pain or tenderness?
No, ma'am.
Okay. At this point, I'm also gonna assess your masseter muscle, and that will detect if you have any abnormalities or defects in the cranial nerve number 5, okay?
Okay.
Alright, I'm gonna ask you to clench your jaws for me. Okay, good, relax. Let's do that again. Good. And I'm also gonna check for TMJ tenderness. Any pain?
No, ma'am.
No tenderness?
No.
Okay, good. At this point, I'll be asking you to check your cranial nerve number 7. And in order for me to do that, I'll be asking you to smile, frown. Can you raise your eyebrows for me? Good. Puff your cheeks. Awesome. All right. So cranial nerve number 7 is working perfectly. I'm going to be assessing your eyes, and I'm going to check your vision. Are you okay with that?
Yes, ma'am.
Okay. So, checking your conjunctiva, pink and moist. Checking your eyes for movements. Good. Square appears to be clean, no lacerations on your eyes, which is good. Okay. I'm going to need you to stand. Place one arm one hand, cover one of the eyes, and you can direct your eyes, the open eye, to the Snellen chart right there, and start from the bottom.
Number 8.
Yes.
Okay. D, E, F, P, O, T, E, C.
Good. Number 7. Line 7.
Line 7
Yes.
is going to be F, E, L, O, P, I, D.
Okay. You want to read line 7 again?
So it's going to be F, E, L, O, P, Z, D.
Great. Okay. 20/20 vision, Mr. Ian. Okay. What I'll do now, I'll be checking your eyes for symmetry. I'll be checking your eyes, how it reacts to my pinpoint light here. And I'll be also checking your gaze, okay?
Okay.
I'm gonna shine this light. Good. Pupils are reactive and direct, which is what we want. Okay, now Mr. Ian, I'll be checking your peripheral gaze.
Okay.
I'm going to still have you cover the left eye, and I'm going to be starting from the right. This is called the wiggle finger test, okay?
Okay.
Okay. So, I don't want you to move your head. What I want you to do is follow my finger with your eyes, not your head, and tell me when you see it, okay?
Okay.
You see it?
Yes.
Okay.
Okay.
Good?
Yes. Yes.
Okay.
Yes.
See it?
Yes. 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 Yes.
Good. That's great. Awesome. Okay. Now you can remove that arm. At this point, we will be inspecting your ears. Is that okay?
Okay.
So I'm looking at your ears right now, and they look very symmetric, normal in appearance. I'm not seeing any lesions on your ears or anything, no drainage. So I'll be taking this a little bit further with my little light here. You're familiar with this, and I'll be checking your tympanic membrane, okay?
Okay.
Can you sit forward for me, please? Thank you. Good. The TM appears to be pearly gray, which is how we want it. I'm not seeing any excessive cerumen impaction. I'm not seeing any drainage, and I'm not seeing any lesions here. So we're good. Let me check the other ear. Tympanic membrane here is also pearly gray, which is good. No obstruction, no excessive wax buildup. That's good. Any pain?
No, ma'am.
Okay. Well, I'm still gonna need this. Looking at your nose, checking the outer area first. Your nose appears to be midline, not deviated to the left or to the right. Any pain?
No, ma'am.
Okay, I'm gonna just put my light, shine my light in your nostrils to check for your turbinates. So, turbinates are clear, and ears are clear, no obstruction, they're both patent, they're nice nice and pink, which is how we want it. And I'll just, in the same breath, I'll check your oral cavity, okay?
Okay.
At this point, I'm checking your mouth. Lips appears to be. Can you stick your tongue out for me? Good. Swing from left to the right. Great. No cavities. Great. I'll be using my tongue depressor here to check your uvula. Back. Good. Tonsils appear nice and pink, not inflamed. Your uvula is hanging, which is awesome. I am now going to be palpating your sinuses, okay?
Okay.
Alright. First, we have the frontal sinuses here. Any pain or tenderness?
No,
Okay, good. We have the ethmoid sinuses here. Any tenderness?
no.
Good. And then we have the submandibular here. Any pain or tenderness?
No.
That is good. Okay, so do you have a history of sinus issues?
Yes, ma'am.
Okay, but you're not being bothered with any symptoms right now, are you?
No, ma'am.
Okay, great. Also gonna use this opportunity, since I'm still on your head and neck, to do your lymph node assessment, okay?
Okay.
At this point, we'll be doing your preauricular lymph node. Feel them here. Great. Any pain?
No, ma'am.
You feel nice and free. Post-auricular. Good. Pain?
No, ma'am.
Okay. Now the tonsillar lymph nodes.
No.
We also have the submandibular.
No. Yes.
Submental right here. No issues. Okay. And we have the anterior cervical here. Good. We have the supraclavicular and the infraclavicular. Any issues there?
No, ma'am.
Okay, good. I'm also gonna assess your shoulders.
Okay.
Can you sit back for me? Oh, great. Assessing for symmetry to look if they're, lap-sided, no, and that they're appearing on the same level bilaterally, which is good. I'll also use this opportunity to do check your range of motion. Is that okay?
Yes, ma'am.
Okay. So I'm assessing your neck. I'm gonna push to the left and you're gonna resist. I wanna see how strong your neck muscles are, okay?
Okay.
Okay. So I'm gonna push to the, okay, wow. All right. Good. All right. I'm also gonna check the range of motion. I'm gonna need you to, your arms like this, and I'm gonna push, and you're gonna try and give me as much resistance as possible. Okay? Good. Okay, all right, awesome. All right. Can you do the same here? Good. Okay. The left and the right. Awesome. Is it possible, Mr. Ian, for you to remove the upper section of your clothing so I can get to assess your chest and abdomen properly?
Okay.
Okay. So at this point, we're going to check your cranial nerves also with a sharp. I have a sharp and a dull.
Okay.
Right? You're going to close your eyes and I am going to tap your face and and without opening your eyes, you're gonna tell me if I'm using a sharp or the dull object. Okay? Alright. What's that? Good. What's that? What's that?
No.
Okay.
That's sharp,
Good.
sharp,
Mm-hmm.
sharp.
Great. Cranial nerves are intact. Alright. With this, I'm gonna be needing my stethoscope because I'll be assessing your heart sounds and I'll also be assessing your lung sounds from
Okay.
both the anterior and the posterior.
Okay.
Okay. So let me get this on. It's maybe a little bit cold.
Okay.
So, okay, so I'm looking at your chest. Your chest symmetry looks good. I'm looking if you have any barrel chest, which is not present, and then we can move on to auscultation, okay?
Okay.
So I'm listening to the aortic valve. Good. Pulmonary valve. Tricuspid valve. And the mitral valve. No heart murmurs heard. I heard the S1 and S2, no S3 heard, which is good. At this point, we're almost complete with the chest, with the cardiac part, so we're gonna get into doing our lung assessment.
Okay.
Still gonna need my stethoscope again. And I'll be doing both your anterior and your posterior lung fills.
Okay.
In and out for me. Good. 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 Okay, good. Breath sounds are clear. No crackles, no rails, no stridor heard, no wheezing. And out. Great. And out. Good. Okay. I'm gonna be checking for lung and ear vibrations, and with this I'll be placing my hands on various parts of your back and I'll be asking you to say 99, okay?
Okay.
Okay.
99.
Good.
99. 99.
Awesome. I'm also gonna be percussing. Good. 3, 4, 5, and 6. No abnormalities heard, no hyperresonant sounds. Okay, Mr. Ian, how are you feeling?
I'm good.
Okay, that's good to know. Alright, we're almost through, but we still have a little bit left, especially to your lower extremities.
Okay.
Is it okay for you to lie supine for me, please?
Okay.
Now I'll be doing your abdominal assessment.
Okay.
First, I'll be looking before I even touch. Checking your abdomen for symmetry. Checking if you're using your abdominal muscles to breathe. And abdomen appears normal, rounded, non-distended, non-tender. Okay? At this point, I'll be auscultating with the bell of my stethoscope. And bubble sounds are present. Not too hyper or not too hypoactive. I'm gonna be doing some light palpation on your tummy, Mr. Ian.
Okay.
Any pain?
No.
Any pain?
No. No.
Good. Now I'll be doing some deep palpation to locate your organs, okay?
Okay.
I'll be starting with your left upper quadrant, and that's where your spleen is located. And I'm checking here for splenomegaly. That's when your spleen is enlarged. And that we don't want because that, could be a sign of an impending infection, okay?
Okay.
On the right upper quadrant, we're palpating for the liver. Good. And also percuss over the organs. Nice sound there. Okay, great. I'm also going to be checking your SOSA sign.
Okay.
And with this one, I'll be using your right leg.
Okay.
I'm going to compress here. And I'm going to flex your leg, and you're going to tell me if you feel any amount of pain at all, okay?
Okay.
Pain?
No.
Good. I'm also going to be doing the arbitrary sign. Could you turn to your left for me, please? Good. I'll be flexing this knee, and I'll be rotating at your hip, and if you have any signs of appendicitis, you'll have pain in your right lower quadrant, okay?
Okay.
Okay. Any pain?
No.
Okay, that is good. Okay, can you sit again for me, please? I'll be using this now to I'll be using this opportunity to check your pulses, your brachial pulse. Good. Radial pulse, like a 2+, which is good. I'm also checking your capillary refill. Prompt. Good. And I'm also checking for signs of clubbing. And how we do this, we use the two big fingers and we put them together, clasp the nails. Great. You have no signs of clubbing, Mr. Ian, and that is good. Can you stretch your legs out for me? Oh. I want to assess your pulse, your lower extremity pulses. Nice. This is a 2+ here. You're going to solid speed this. Awesome. I'm going to do a whisper test on you.
Okay.
Okay? What this, they call it the Weber test. I'm gonna whisper, say 3 or 4 words in your ear, and you're gonna repeat to me what I said. just to see how is your hearing conduction, okay?
Okay.
Here we go.
Sun, moon, stars.
Okay, your hearing is on point. Alright, at this point, I will be doing your Rumberg test.
Okay.
And with that test, I'm gonna need you to stand. And I'll be checking your gait. If you have any problems walking, any abnormalities, your gait is straight. Can you walk towards me, please? Good. And back. Awesome. Any pain?
No, ma'am.
And at this point, can you turn towards me, please? Thank you. I'd like you to close your eyes and extend your arms forward and tell me how you feel.
Very good.
Do you feel like you're fainting? Any dizziness?
No.
Any syncope?
No.
No? Okay. Good. You wanna have a seat for me? And how are you feeling right now?
Feeling good.
Okay. You have any questions about the exam?
No, ma'am.
Okay. I also wanna check your deep tendon reflexes. Have you ever gotten this done before?
I think so, ma'am.
Okay, so we'll be checking your brachial reflex. Okay. All right. Good, that is awesome. Good. I am also going to be doing your patella reflex. Thank you. Okay. And I'll be trying to elicit a response here. Good. Your reflexes are great. Awesome. What did I forget? Okay. You must be wondering why I have this glass of water here, aren't you?
Yes, ma'am.
Okay. So this is for you. This is your gift for your physical assessment. What I need you to do, I need you to drink, take a sip, hold it in your mouth, and I'll tell you when to swallow, okay?
Okay.
Thank you. Stethoscope is falling off here. All right. Can you swallow, please? Good. Swallowing reflex. Good. Any pain?
No.
Okay. Now I'm just palpating for your thyroid and your trachea, midline. Good. Okay. Clavicular feels good. Any pain?
No, ma'am.
No. Okay. That's assessing your lymph nodes. Good. So, Mr. Ian,
Yes, ma'am.
now that we're through with our physical assessment, do you have any questions for me?
Not necessarily, ma'am. Everything seems to be okay.
Okay. Do you have any, I have an issue, but my only issue is with your BMI.
Oh, I heard that before, ma'am.
Yes, and it's 29.5, which places you a little bit in our overweight section.
Okay.
How are you planning to address that?
Well, you can go off the exercise and,
Right? And how about your diet?
well, work on that too.
Okay.